So I'm going to take you on to the next section of our video about pre-birth reviews. So we obviously we are using the same person that I used for the beginning of the video. So if you need to go back over your navigation, then please go back to that first part. So I'm going to go straight into it. So I have said that this person is being seen in triage. So I'm going into my notes during pregnancy, and we can see we have a query in labour section here. So the assessment unit, we are seeing the main reason for attendance is query in labour and also query SHROM. So for the purposes of training, I'm also just going to pretend that this person is now on labour ward, and we have been, as the neonatal team, asked to review and do a pre-birth preparation. So in the future, this may change as we have requested for a form to be put in, but for now we will do the same as before. We will go into enter new note and do a specialist review, and we will enter our information in here. So our specialist type, for example, neonatal SHO, conducted by obviously the person or ourselves. So if there's two people attending to the person, potentially one could be giving the discussion while the other is recording on Badgernet. So we've got whether we want to lock it from changes. So do we need to go back into the form and be able to change what we've written? Yes or no. Obviously our type of user, obviously whatever is appropriate. So in this case, we'll say doctor. Our assessment face-to-face. Location, we will say we're on labour ward now. So we can say that we've noted our history and background. And again, we've got an overview of everything going on down on this right hand side here. We can add any additional comments about our history and background. We have our review section, our examination section, and our discussion. So if we are doing a pre-birth review, obviously we can comment the review section in here and then the discussion with the woman afterwards. The form potentially may appear in the future, but I would recommend maybe taking the paper copy with you as a prompt. So obviously everything is remembered to be covered. We can then also upload that document afterwards if you so wish, or obviously if you're happy with everything that's been discussed and recorded in here, that's absolutely fine as well. So our date of conversation, we can either leave it as blank because it's the same time as the time recorded, or if you're doing it a little bit later, you can obviously update that. If we're doing it on the ward, we'll say that the conversation took place in person. And again, do we want to publish that to the maternity notes app? So obviously, if we're giving people lots of information, it might be applicable and appropriate to be able to publish it to their app instead. So obviously we might click yes and authorise. In this case, I'm going to say no. So there's also a possibility for us to be able to do a preterm birth preparation form, which will enable us to say that we've got the room ready for delivery. So this can only happen once the person is marked as in labour. So we have a labour assessment here, and we go into our labour and birth section on our menu. So from here, we then have a section that says preterm delivery preparation, where it obviously comes up in yellow. If we click on that, it then comes up with a form. So obviously we can say whether we've confirmed the placental site. Obviously the neonatal team have been informed. We can add names. So obviously an intrauterine transfer probably at this time would not necessarily be applicable unless it's already happened. So you can say yes. We've got obviously antibiotic therapy. If we would do that or not, we can specify. We also don't have to answer the questions. It's there if we need it. So plastic bag and hat available if 32 weeks. So we would say yes. Obviously, in the cases over 32 weeks, you can put not applicable. So making sure the room temperature is correct, that we have the livestock trolley, so this will be our neonatal resource trolley, ready and accessible for us. So we may not use it, but at least we've got that there prepped and ready to go. So we can say yes. Obviously, is this person on a continuous CTG? So we'd say yes. Obviously, if we have time, we can talk about the benefits of expressing breast milk early. That might not be, we might not have enough time for that. There's also records about Magsolf, whether it's been given prior to birth, so potentially we put no. Birth imminent, or we've obviously also got steroids given as well, so obviously yes, what date and time. If it's already been recorded, then it should be on here. If it hasn't, then it may need to be entered. So obviously if we put no, it will ask us for the reason why they haven't given steroids, so we can put those on there. If we hadn't finished, so if we were going to come back, we've got this form, we can do save and close, and then we can click back anywhere on this section and it will take us back into that form again, so we can access it. So you also have some information down the side, so you have your risk factors, your management plan, and whether any steroids have been recorded at present. So, okay, so once the baby has been born, we can then mark our resuscitation details. So the midwife can go through and quickly complete enough for the resuscitation page to be accessed. It is also currently in the works for us to be able to access this form prior to the completion of the birth section. But at the moment, the baby has to be delivered and marked as delivered on the system until we can get access to this form. So obviously we have this in this section, we have labour and birth, and we can go into baby. Once we're in baby, we can see further down, someone has marked that the baby has been resuscitated, so we now need to go in and record the actual resuscitation details. So if we click in that section, it obviously comes up with our pro forma. So we have access to the birth details there. Obviously, we can see we have prematurity in this case, and we can say what type of delivery they had and whether there's any skin to skin. So potentially this may be the midwife filling this in. So obviously there's a question about whether delayed cord clamping was happening. So you can obviously put yes, what date and time that was done, and obviously the length of the delayed cord clamping that happened. So if it was obviously less than a minute. So if we go back into our resuscitation details, we then obviously have a full form of everything. So we can put in our date and time called for assistance, date and time assistance arrived. Obviously in most cases, potentially assistance will already be there. So dry, wrapped and assessed, so we can put yes. So every time we answer a question as yes, it will give us more of a form to fill in. So we can mark the date and time that we added that in, the tone, heart rate, breathing, and who obviously performed that assessment. So again, positioning the airway, date and time, when we've achieved that neutral position, any extra comments, and who performed that. So if we then move on to our inflation breaths, obviously, again, by selecting yes, it extends and gives us space to add more information. And again, further down, so chest movement seen or increased heart rate, we could put no. So when we put no, it's obviously making us do things to recheck that everything's in place. So it's kind of like the Resuscitation Council flow chart. So obviously, are we doing our O2 monitoring? Have any inflation breaths been given? How many, or how often, for how long? Cardiac compressions, again, date and time, and whether the baby was intubated, first time of breath, and when regular respirations are established or whether they're not. As we go further down, we've got resuscitation methods. So obviously whether we're doing it by mask, by endotracheal tube, or whether drugs have been administered or not. So we can talk about airway manoeuvres. So if we inspected the airway, if we've done a jaw thrust, Goodell, and any drugs that are administered. So I believe once we put the drugs are nil, no, we need to go back and sort that. So if nothing has been given, we can click other and put none for the moment, but I will make sure that this is not a mandatory question by the time we are live. So again, we can say who the resuscitation was led by, their role, who was the scribe. Again, by clicking in the box, it will bring up our search functions. Again, was the resuscitator used? We can put obviously what number resuscitator. Anything extra that we might want to put. If we don't want to fill in obviously this form as we go, there's space to be able to type our times as we go. So neonatal and then obviously the form can be filled in afterwards. Again, who's been present at birth? If you guys don't know about that, you can leave that blank for the midwife, and also your Apgar scores and whether any cord bloods have been taken. So you can access this from level 14. So if you've gone upstairs with the baby, then you can fill this in once the baby has reached upstairs. So I'm just going to show you a quick view of how the baby comes across in Neonatal Badgernet. So at the moment I have the neonatal version of Badgernet open, and we have our patient list here, and the baby that I was just discussing is at the top of the list. So if I double click, obviously we have the record as you would see normally. When it comes to the care episode history, if you click in there, you can see the birth details from here, potentially maybe not very much. If you want to go back to the maternity record, if you click on this button here, it will link you straight into that person's record without having to log out and log back in again. We have discovered that the resus information does not come across. So I know as part of your admission details, you do have to fill in the information at birth, so your management at birth. The Apgar scores do carry over in a very simple version, and although I believe, no, so it's just a very simple version. When it says your initial management at birth, if we say resuscitation, obviously it's asking for very much different information than what we already entered as a contemporaneous record in Maternity Badgernet. So we obviously have this that you may have to complete as well. We will confirm that with you once we have that 100% set out, but obviously you can see that that information is blank. We have that record obviously in our so you have your pregnancy details here in your patient summary, so obviously care episode history, and we can go straight into the maternity record. So it takes you straight into the pregnancy summary page. We have our labour and birth details. We go along to baby, and we have our resuscitation information here, which should have been completed at birth.